Hey there, my name is Pam Strand. I have worked in the field of dentistry for over 20 years, for 10 years as a dental assistant, and the last 10 years as a registered dental hygienist. Over my time in the field, I have worked in one dental office, and that has been my inspiration for this continuing education course that I propose for dental professionals on communication in the dental office. Communication is a tool that we use to send and receive messages. And the fundamental components of communication are listening, verbal communication, and nonverbal communication. In dentistry, informed or at least implied consent is necessary before any treatment. Therefore, clear communication is important to ensure the patient understands the proposed treatment plan. As well, dental professionals are concerned with the overall health of the patient, and communication is a valuable tool to improve the patient's oral health literacy. It's also important to consider the barriers, such as stereotypes of dentistry and dental professionals, that impact not only patient care, but interpersonal communication within the dental office. Some stereotypes are that dentistry is painful, dentists only want to make money, or that hygienists are divas. Dental professionals are always learning about new products and techniques that can help them improve their practices. They won't be able to integrate them, however, unless they can effectively communicate what they've learned with others on their team. This program was designed for a moderately sized dental practice with no more than 12 to 15 participants, including dental hygienists, dentists, dental assistants or expanded function dental auxiliaries, and front office personnel. There are two important communication needs to consider in the dental office: patient communication and interpersonal or interprofessional communication. A patient's dental anxiety is very important for professionals to remember. Poor communication can increase their anxiety, which can cause them to become fearful, angry, or even avoid dental treatment altogether. Understanding is important in decision making. Helping patients increase their oral health literacy will help them make decisions about their oral health. This requires keen communication skills from the dental professional. It's especially true for those who work in dental offices with patients from a wide range of backgrounds and cultures, like those near military bases. Each dental profession has different levels of responsibility. The hierarchy helps to alleviate the burden of patient care from one group of professionals, like the dentists. If communication between groups of professionals, however, diminishes their value from the team, it can lead to further breakdown in communication as well as work performance. Not only will improved communication have effects on a patient's anxiety, which can impact their oral health literacy and overall oral health, but they will also be more likely to schedule for recommended treatment, which can be a benefit to the practice. Decreases in stigmatizing and defensive language can not only improve interprofessional relationships, but it could also lead to a more productive work environment. This course was designed for the dental office with two major considerations in mind: time and money. How much time will this course take away from patient care, and will the outcomes of the course outweigh the cost investment for the participants? All professionals within the dental office communicate with patients and with each other, so all of them will be target audience for this course. Communication changes that lead to patient and practice improvements could also lead to decreased stress for the participants. This would benefit not only their professional lives, but possibly even their personal. Participants may enter into this course believing that it is more important for others rather than themselves. That's why role-playing activities have been created to engage all participants in the material. The first set of program outcomes stems from improved patient communication. The primary outcome being the improved oral health literacy of the patients. Once the patient has a better understanding of their oral health and what may affect it, they will be more likely to accept the treatment plans proposed by their dental professionals. The second set of program outcomes is related to the practice itself and its employees. Not only will improved patient communication increase treatment acceptance rates, it will decrease the likelihood of the patients leaving the practice. Changes in interprofessional communication may lead to culture changes, but can be measured by a decrease in stigmatizing and/or defensive language. Because of the level of engagement required of the participants, as well as the instructors of this course, expanding it to accommodate large dental offices, such as corporate offices with 20 or more employees, doesn't seem feasible at this time. This course was designed with two learning theories in mind: constructivism and andragogy. The participants will come to the course with their own experiences and expectations. The written material will be delivered in a way that considers the participants' autonomy. The group activities will engage them in critical thinking about how the new material can change their perspectives on their past experiences, as well as how they may apply it to their future. In consideration of the participants' availability to complete this course, it was developed using a hybrid and flipped classroom model. The participants will access the course material online and have 2 weeks to study it. There will be 4 modules with short quizzes at the end of each and should take no more than 2 hours to complete. They are given 2 weeks so that it can be done when they have a break during business hours and no patient care is missed. The 6-hour in-person session will expound on each model and help the participants connect the material to their practice. It will begin with a discussion, then an instructor-led demonstration of the concepts, and end with role-playing activities for the participants. In order to meet the course outcomes, there must be changes in the participants' communication patterns. The objectives for each module are first to check their understanding of the material. Then the objectives are that the participants are able to apply what they have learned into their communication with patients and each other. The first module is all about listening. Through an online quiz and in-person discussion, participants will be able to give examples of appropriate listening skills. Then, with in-person presentations, the participants will be able to demonstrate appropriate listening skills for patient and interprofessional communication. The second module is about nonverbal communication. After the participants reach an understanding of the concepts, they will participate in presentations. They will be able to demonstrate their ability to apply nonverbal skills that can improve their communication with their patients and with each other. The third module focuses on verbal communication. The objectives for the participants are to understand the specific words that can help or hinder their communication. They will give examples and demonstrate the use of task and emotion-focused goals, as well as stigmatizing and non-stigmatizing language. The final module will cover various communication techniques. Demonstration of motivational interviewing techniques will help them improve their patients' oral health literacy. Demonstrating the use of supportive versus defensive language and psychological safety concepts will help with interprofessional communication. The online portion of the course will be created using a Google site. The modules can be clearly organized for easy access in either one or multiple settings. As well, links to websites, videos, and quizzes, which will be created using Google Forms, can be easily added or embedded on the pages. Participants will be assessed in two ways. The Google Forms will be placed at the end of each online module to assess their understanding of the new material. Those results will guide the in-person discussions. The ability of the participants to apply the new material will be assessed during the role-playing activities. The tasks necessary to run this program include designing the course instruction, marketing to and corresponding with the dental office, maintaining the budget, instructing the course, and evaluating the outcomes. I will be the one to take on the tasks of the program initially. After it shows the ability to help offices reach the outcomes, I'll begin recruiting for additional staff to help run the program. Opportunities may come from professional associations or social media groups. As well, dentistry is a small community to those in it, and word of mouth may also be an effective strategy. This course will be offered monthly, so to ensure that all aspects of the program are well managed. Each month will follow the same schedule. In the first week, the pre-course questionnaires and the link to the online material will be delivered, as well as collecting the registration fees. As the participants complete the online content and the questionnaires, week 2 will be dedicated to reviewing that data. In-person instruction will happen on a weekday during week 3. Post-course evaluations will be delivered, collected, and assessed in week 4, along with disbursement of the CE credits. This course will have a $150 participant fee, and there will be a 6 participant minimum for each course. I will personally loan the money for the startup equipment and the CE recognition fee, and repayment will be budgeted into additional salary each month until those costs are recovered. The regular monthly expenses are going to be staff salary and refreshments for the participants during the in-person session. Provided refreshments are a staple for any dental CE course and will help with marketing the program. There will also be an annual renewal fee for the CE recognition. In order to evaluate the program's effectiveness, I will create questionnaires for the participants to complete before and after the course. As well, I will ask the practice owner or office manager for specific practice data that can be found by running a report in the dental software. The easiest outcome to evaluate will be treatment acceptance rates. Oral health literacy will be more challenging, but can be tied to treatment acceptance. Otherwise, findings noted at preventive appointments can also indicate improved oral health literacy. This can include reports of increased oral home care and decreased risk factors for cavities and gum disease, such as plaque, bleeding, and poor diet. Practice outcomes can be indicated by ensuring that the rate of patient attrition decreases or remains stable. In interprofessional communication, employee-reported language and morale changes can indicate positive outcomes for the program. Questions regarding stigmatizing language, enthusiasm, positivity, conflict, and vulnerability will help in the assessment. Investing in this program will ideally lead to increased production for the practice. The biggest portion of production comes from restorative treatment, so a 10 to 20% reduction in unscheduled treatment would indicate increased production. While preventive visits do not produce as much, they are where treatment needs are assessed and an indication of a stable patient base. So a 10 to 20% decrease in unscheduled hygiene appointments and a stable 10 to 12% attrition rate would be a significant ROI for the practice. I plan to market this program to my current dental office. Ultimately, it will be up to the practice owner to determine if it's worth the investment. Because there's no past data to show the effectiveness of the program, I'll use my knowledge of the office's needs and explain how I believe this course could meet them. There are aspects of this program that will appeal to certain professionals more than others. Dentists take home more income because they generate the most revenue for the practice. So for them, it's important to identify how this program can increase production. For practice owners, it would also be important to point out that decreased patient attrition means stability for the practice. As well, increased production could lead to increased employee benefits and prevent frequent turnover. Hygienists are concerned with helping patients prevent disease. They will understand that improving patients' oral health literacy is key to improving their oral and potentially overall health. While not involved in clinical care, front office staff will benefit from this program as well. Improving patients' oral health literacy means they will accept treatment with less hesitation, and front office staff will have an easier time scheduling and discussing out-of-pocket costs with the patient. Once data has been collected and an ROI can be proven, I'll begin to market this to other dental offices. Production is a significant driver for many offices, and I'll be sure to use that in my strategy. Besides asking past participants to share their experiences with other people from other offices, I will likely use the dental professional social media groups to share the course. Thanks for listening to my proposal. I am very passionate about this topic and excited about this project, and I really look forward to continuing to develop it.